my name is Arrie Hyder. I'm an F&P student at the University of Memphis. Today is October 27th, 2024. This is a head-to-toe assessment for the fall 2024 class or semester. Now I'm going to scan my room. All my supplies. Under the desk. Door. And supplies again. And this is just an old moving box. There's nothing going in here. Okay. I've provided privacy, I've performed hand hygiene, and I've confirmed patient identifiers. The skin assessment will be done throughout the exam on the head, the neck, the anterior, posterior chest, and the abdomen, and the face. I'm looking for color, texture, temperature, moisture, turgor, scars, bruising, lesions, nevi, and tenderness. Don't know if I say redness, but that too. And now I'm going to look at the head. It's normal cephalic, it's midline to his body. It looks symmetrical. I'm looking at his scalp and palpating. I'm palpating for lesions, nodules, infestations, depressions. I don't feel any. Is this tender?
No.
It looks symmetrical to me. His hair texture is smooth and curly. It's evenly distributed. The color is brown, and he said there's nothing tender. All right, now I'm going to look at his temporal arteries. Is this tender?
No.
All right, now I'm going to palpate his lymph nodes. We have preauricular, postauricular, occipital, posterior cervical, anterior cervical, supraclavicular, and tonsillar, submandibular, and submental. Was any of that tender?
No.
All right, I'm going to palpate for his TMJ. Please open and close. Very good. I didn't feel any subluxation, crepitus. Was it tender?
No.
All right, now I'm going to do his cranial nerve 5, which is his motor nerve. Please clench your jaw for me and open your jaw and move it side to side. Very good. Now close your eyes. I don't know if I said cranial nerve 5 is the motor nerve. Please tell me whenever you feel this sensation.
No. Or yeah, actually, yeah, I felt that.
Okay.
Sorry. Yes, 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 yes.
Very good. Now we're going to do cranial nerve 7, which is the facial symmetry nerve. So smile. You can open your eyes, sorry. Smile, frown, raise your eyebrows, puff out your cheeks, purse your lips. Very good. All right, now we're going to be looking at his ears. His ears are midline to his body. They have an average or normal shape. Now we're going to feel his tragus and his pinna for any masses or tenderness. I don't feel any masses. Is any of this tender?
No.
Very good. Now we're going to look at his inner structures. His auditory ear canal is pink and his tympanic membrane is pearly gray. His auditory ear canal is pink and his tympanic membrane is pearly gray. Now we're going to do the Weber test for lateralization. But before I do that, I'm going to do a whisper test. This is going to be for cranial nerve 8, the vestibulocochlear nerve. Tell me when I whisper.
1, 2, 3.
7, 8, 9.
7, 8, 9.
Very good. Now for the Weber test, tell me if you can hear this better in one of the other ears or if you can hear it equally in both.
I'd say equally in both.
Okay. Now for the Renee test, there's going to be 2 locations, location A and B. You tell me which one you hear it better in. We want air conduction to be greater than bone conduction.
A. Or whoa.
B. A.
Okay, definitely A.
B. A.
A.
Very good. All right. Now we're going to do the eyes. We're looking at his eyebrows. I'm palpating for any fissures around his eyes. I don't feel any. His eyebrows are equally distributed and they extend past his eyelid. Now I'm looking at his eyelashes. They curl up on the upper lashes. The bottom lashes curl down. I'm going to check out his conjunctiva. I'm going to look at his bottom conjunctiva. It's pink and moist. The sclera is white. I'm going to look at his upper conjunctiva. It's pink and moist and the sclera is white. We're going to do cranial nerve 2, which is the optic nerve. First, I'm going to test his peripheral vision. So tell me when you can see my fingers.
I can see them.
Very good. Now we're going to use our Snellen chart. I'm gonna set it up for my patient. And go ahead and cover one eye and tell me if you could, well, read the lowest line possible or the smallest line possible.
LTFPH.
Great, now cover the other eye and read the same line if you can from right to left.
HPFTL.
Good, now read the line with both eyes.
LTFPH.
Good, the patient has 20/20 vision. Now we're going to do cranial nerve 3, which is the oculomotor nerve. And we're going to test for his pupillary response. I'm going to go ahead and use this. If you could look at my nose for me. Help if you turn the light on. Okay, his pupils dilate, or his pupils constrict to the opposite consensually, and usually I would have dimmed the lights. Now I'm going to do some conversion tests, so look over my shoulder and look at this finger. Follow it with your eyes and not your head. Very good. Now I'm going to test for cranial nerves 3, 4, and 6. That's the oculomotor, the abducens, and the trochlear. So we're going to do the cardinal fields of gaze. So if you could follow my finger with your eyes and not your head. Very good. Now we're going to look at his inner eye structures, and we're looking for his optic disc and his red reflex. Look at my nose again. Okay, his optic disc is yellow and well defined bilaterally, and his red reflex is present bilaterally. Now I'm looking at his nose. We're going to do cranial nerve 1, and we're going to close your eyes. Tell me what you smell.
Alcohol.
Very good. Now occlude one of your nostrils and sniff, and now the other. Both of his nares are patent. Now I'm going to feel for his maxillary and frontal sinuses, but before I'd like to note that there was no discharge in his eyes. Was any of that tender?
No.
Good. And now we're going to look at his mouth, so please open your mouth for me. I'm looking at his, lift up. I'm looking at his lips, his gums, his teeth, the floor of his mouth, his tongue, his soft palate, his uvula, his buccal mucosa, his salivary ducts, his posterior pharynx, and it is all pink and moist. Thank you. You can close. Now we're going to do cranial nerve 9 and 10, which is the vagus and the glossopharyngeal nerve. So if you could open your mouth and say, ah. Good. His uvula and his soft palate rose on phonation, and he's talking to me. Now we're going to do cranial nerve 12, which is the hypoglossal nerve. You can stick your tongue out. Good. The tongue is midline with no fasciculations. Bless you.
Sorry.
That's okay. Now we're going to look at his trachea. It is midline with no deviations. Now I'm going to palpate his thyroid gland. So if you could swallow for me. Very good. I didn't feel any goiters. Now we're going to do his carotid arteries. Very good. Those are both +2. And now I'm going to listen for bruits over his carotid arteries as well. I got my diaphragm and my bell. And I don't hear any. Now we're going to turn my patient to the back. Put it sideways on the chair. Thank you. All right. I'm looking at his posterior chest, and it looks, there's no obvious deformities. It looks symmetrical. I'm going to do some tactile fluidness. When you feel my hands, please say 99.
99. 99. 99.
Very good. Now we're going to palpate for chest expansion. So if you can take a deep breath for me. Good, and exhale. Good, his chest expands symmetrically. Now I'm going to palpate over his intercostal spaces on his posterior chest. And on percussion, all I hear is tympanic sounds. Now we're going to listen to his posterior chest, starting over the scapula. Okay, and I hear vesicular sounds. Now we're going to do some tests for some consolidation. We're going to start with agophony. When you feel my stethoscope, please say E.
E. E. E. E.
mark off fee whenever you feel my stethoscope. Please say 99.
99, 99, 99, 99, 99, 99.
Very good. Now we're going to do whisper pectoriloquy whenever you hear or feel my stethoscope. Please whisper 1, 2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Very good. And all that sounds good. Now I'm going to look at his anterior chest. Okay, it's okay. Okay, we're going to look at his anterior chest. I'm looking for any obvious deformities. I don't see any. It looks symmetrical. We're going to do tactile firmness. Please say 99 when you feel my hands.
99, 99, 99.
Very good. Now we're going to do chest expansion. Please take a deep breath. Good, and exhale. Very good. His chest expands symmetrically. Now I'm going to listen to his lung sounds on the front of his chest. Good. All I hear are vesicular sounds. There's no adventitious breath sounds on the anterior or posterior sides of his lungs. Now I'm going to listen to his heart, starting with my diaphragm. The second intercostal space right of the sternal border is the aortic. The second intercostal space after the sternal border is pulmonic. The third intercostal space after the sternal border is Erb's point. The fourth intercostal space after the sternal border is tricuspid. And the fifth intercostal space after the sternal border is mitral. Now I'm going to listen with my bell. We've got aortic, pulmonic, Erb's point, aortic, pulmonic, Erb's point, tricuspid, and mitral. Right here is the point of maximal impulse. I'm going to listen for 1 minute and get his heart rate. And his pulse is 73. There's an S1 and S2 sound present, and there's no extra heart sounds. He has a regular rate and rhythm. Now we're going to have my patient lay down at a 30 to 45 degree angle because we're going to look for jugular vein distension. I'm going to recline him. You can look that way and this way. And I don't see any. I'm going to lay my patient back. Now put your hands by your side. I'm looking for any heaves or lifts. I don't see any. We're going to palpate over those areas I just listened to. We've got aortic, pulmonic, Erb's point, tricuspid, and mitral. I don't feel any thrills. Now we're going to listen to those same areas. First, starting with my diaphragm. We've got aortic, pulmonic, Erb's point, tricuspid, and mitral. Bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. Again, S1 and S2 sounds are present, no S4 or S3, no extra sounds, and there's a regular rate and rhythm. Now I'm just going to be looking at his abdomen. It's flat, it looks symmetrical. I'm going to listen to his arteries for bruits. We've got aortic, aorta, the iliac, reaches into the renal, and then the femoral. Okay, my bell, aorta, iliac, renal, femoral, and I don't hear any bruits. Now we're going to listen to his vowel sounds with my diaphragm, starting in the right lower quadrant. And usually you would listen for 5 minutes. His vowel sounds are normal active. Now we're going to do percussion over his abdomen, starting in the right lower quadrant. Okay, I hear tympanic sounds. Now we're going to do light and deep palpation. First we're going to do light. Was any of that tender?
No.
And I didn't feel any masses. Now we're going to do deep. Was any of that tender?
No.
And I didn't feel any masses. Now we're going to palpate in the right upper quadrant for the spleen. So take a deep breath for me. Nope, for the liver. The liver's on the right. Thank you. And now we're going to feel for the spleen on the left upper quadrant. Goodness. Spleen's on the left, liver's on the right. Okay, I can't feel the spleen, but I am able to feel his liver. Now I'm going to have my patient return to the chair and present his posterior chest to the camera.
What is
Oh, sorry, that's the back. Yes, sir. And now we're going to do some CVA tenderness. Tell me if you feel this, or if this is tender.
No.
Fantastic. So I'm going to turn you back around. Okay. Let me know if it goes dark. All right.
Mm-hmm.
Now I'm looking at his musculoskeletal system. I'm looking at his fingers, hands, his wrists, his elbows, and his shoulders. I'm looking for redness, deformities, crepitus, nodules, and symmetry. And I don't see any. Everything looks symmetrical overall. I'm going to do a scapulary refill. And that's all, less than 3 seconds. I'm going to do his radial pulses, and those are 2+. Now let's do some range of motion with our fingers. So we've got flexion, extension, hyperextension, abduction, adduction. Good. Now with our wrist, we have flexion, extension, hyperextension, radial deviation, good, ulnar deviation, and rotation. Very good. Now with our elbows, we have flexion, extension, flexion, extension all the way out, good. Hyperextension, good. Now we're going to do our shoulder girdle. So we have flexion, extension, hyperextension behind us. We have abduction, we have adduction, we have internal rotation, we have external rotation, good, and we have circumduction, very good. Now I'm going to do the grips of his strength, so grip my hands. Thank you, that's 5 out of 5. I want you to, with your biceps and your triceps, flex against it, good, and extend it, very good. Now, for your shoulder girdle, I want you to abduct away, good, and adduct in, good. All of his strengths are 5 out of 5. Cranial nerve 11 is the accessory muscle nerve. I want you to shrug your shoulders for me, good, and it's intact. That is also also at 5 out of 5. Now we're going to do sterigenosis and graphesthesia. Make sure my computer doesn't lock. Okay. Now if you'll open your hands for me. Very good. Yes, and close your eyes. What is in this hand?
Paperclip.
Very good. And what is in this hand?
Battery.
Very good. Now I'm going to do graphesthesia, so keep your eyes closed. Keep your palms up for me. Tell me what I draw.
T.
Very good.
8.
Very good. And now we're going to do cerebellar coordination. So clap your hands real fast on your lap as fast as you can. Very good. Now I want you to do finger to finger with me. Go as fast as you can. Very good. Now whenever you see my finger, I want you to touch your nose and touch my finger as fast as you can. Okay, so here we go. Very good. Very good. Very good. One more time. Great. Now we're going to do vibratory sensation. Or actually, let me do an overall skin assessment of his upper and lower extremities. I'm looking at the color, the integrity, and the temperature. It all feels very warm. It's dry. The integrity looks good. He's well hydrated, and I don't see any edema either. And the color is normal for his ethnicity. Now we're going to do some sensation all over his upper and lower extremities. So close your eyes and tell me when you can feel this.
No. 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 No.
Very good. All right, now we're going to do some vibratory sensation, and you tell me when you can, if you can feel this. Goodness.
Yeah.
I'm sorry. It should be over here.
Yes.
Over here.
Yes.
Okay. Open your legs for me.
Yep. Yep.
Very good. Now we're going to do some deep tendon reflexes. First, we're going to start up here at the brachioradialis. Now we've got the bicep. Good. Now we have the tricep. Good. We've got the patellar. Good. The Achilles. And then the Babinski. Very good. Okay, and so now I'm going to look at his feet. I'm looking at his toes, at his ankles, at his knees, at his hips, and I'm looking for redness, deformity, crepitus, nodules, any warmth to the temperature, And then symmetry, it all looks symmetrical to me. I don't see anything else. Are any of those tender?
No.
Okay. Now we're going to do some capillary refill of his toes. It's all less than 3 seconds. Now I'm going to do some pulses, so his dorsalis pedis pulses. You can't see me good. Okay. Those are 2+. His posterior tibial pulses, those are both 2+. Now let's do some range of motion with our toes. So we've got flexion, extension, hyperextension, abduct away, adduct in. Very good. Now let's do our ankles. We've got plantar flexion, dorsiflexion. We've got inversion, eversion, and rotation. Awesome. Now for our hips, we're going to abduct away. Good. Adduct in. Good. Just about for fun, I guess. Now we're going to stand up and we're going to do some range of motion on our hips. So we've got flexion, extension, hyperextension, abduct away, adduct in, inversion, eversion, and circumduction. Cool. We've got flexion, extension, hyperextension, abduction, adduction, inversion, eversion, circumduction. Let's go. Knees. We've got flexion, extension, hyperextension, good, flexion, extension, hyperextension, great. Now I'm going to actually have you sit back down. I'm going to do the strengths of those things. I want you to plantar flex down, good, dorsiflex up, good, and extend out with your knees, good, flex in with your knees, good. Now for your hips, I want you to abduct away, good, and adduct in, and all those strengths are 5 out of 5. Please hop up for me again. Wait, turn to the side and bend over. I'm looking at his spine, I'm looking at the alignment, the curvature, signs of scoliosis. I don't see any. Now I'm palpating for any tenderness. Is that tender?
No.
Okay. Now we're going to do some, you can sit up. Now I'm going to do range of motion of his spine, so face the camera. We're going to do, don't let that lock. We're going to do flexion, extension, hyperextension, lateral rotation, and circumduction rotation, yeah. Now for our cervical spine, we have flexion, extension, hyperextension, lateral, and rotation. Good. Now I'm going to have you stand, look at the camera. Now close your eyes. Good. His Romberg test is negative. Now I'm going to have you take some steps forward, just regularly. Good. Now you can turn around and walk heel to toe back. Away. Heel to toe. There we go. That's tandem walking. Now if you'll face the camera, hop on one foot. Good. And now the other. Good. And if you'll sit back down real quick and present your back of your back to the camera. I forgot to look for signs and symptoms of respiratory distress. I'm looking for retractions, tachypnea, tripod position, nasal flaring, cyanosis, and I don't see any when I look at his chest. Thank you very much to my patient. That'll conclude my head to toe assessment. Thank you very much.